evening, everyone. Welcome to our series this evening, Prescribing Positivity. The Office of Health Ministry of the AME Zion Church, we invite all of you, all of our members, to join us as we invite health specialties from varying health areas to join us, share their expertise with you, with our congregations and our communities around the world. Tonight, we are so blessed to have two dynamic professionals in the area of women's health. Stay tuned. We're going to learn about breast health, ensuring that you're getting the right screenings, not only for breast disease and breast cancer, but also diseases of the cervix, the uterus, like fibroids. Learn what questions you should be asking your healthcare provider. Also learn about those warning signs, things you need to pay attention to. So I'm really excited this evening to introduce you to our panelists, and I'll introduce them in alphabetical order, starting with Dr. Kondeh Greaves.
Dr. Veslow.
Welcome to the show, Dr. Greaves. Dr. Greaves, you are welcome. Dr. Greaves was born in Liberia, West Africa. She spent her formative years there and then completed her secondary education in Zimbabwe. Later returned to Liberia, where she began her college career. This was interrupted due to the Liberian Civil War, and she eventually immigrated to the U.S. to further her education. Her experiences, though, during the war and stay in several African countries has really influenced her life and her global view. Dr. Greaves holds a Bachelor of Science degree in pre-med and medical technology from St. Augustine's College in Raleigh, North Carolina. She's a graduate of Meharry Medical College in Nashville, Tennessee, and she completed her training in obstetrics and gynecology, beginning at Emory University in Atlanta, and then finishing up her residency at Wayne State University in Detroit, Michigan. She has done research in the fields of obstetrics and reproductive medicine. She's a member of several honor societies, including Alpha Omega Alpha, Alpha Kappa Mu, various professional organizations. She's a fellow of the American College of Obstetrics and Gynecology. In her free time, she is passionate about life. She loves movies, traveling, CrossFit training, music, and then also supporting and volunteering for social causes, both locally and in her homeland of Liberia. I'm so proud to know her. She is a practicing obstetrician and gynecologist at Kaiser Permanente Mid-Atlantic Medical Group in Ashburn, Virginia. So welcome again, Dr. Greaves. We're so honored to have you.
Thank you. I'm honored to be here.
Wonderful. Our next panelist this evening is Maimah Karmo. So happy to have you on, Maimah.
Glad to be here. Thanks for having me.
Wonderful. You are so welcome. Maimah is the founder and CEO of the TigerLily Foundation and an 18-year survivor of breast cancer. We'll allow Maimah to share her testimony shortly during the interview and how TigerLily was born during this trying time in her life. She's an internationally recognized advocate for breast cancer awareness. She's worked with Congresswoman Debbie Wasserman Schultz to develop the EARLY Act, Breast Cancer Education and Awareness Requires Learning Young Act. She's received the Congressional Black Caucus Leadership and Advocacy Award in 2010, was appointed to the Federal Advisory Committee on Breast Cancer in Young Women in October of 2011. This was a committee established by the Affordable Care Act, on which she works to develop initiatives to increase knowledge of breast health and breast cancer for women under the age of 45 and those at heightened risk for developing the disease. She continues to advocate with members of Congress to ensure that young women have access to breast screening. She's also a first-generation immigrant from Liberia. She's experienced disparities firsthand and continues to be a leader in women's health and implementing both national and international health initiatives for women and girls in the hope of eliminating those disparities of age, stage, and color. We can tell she's a global thought leader. She's also a sought-after speaker on health equity and diversity. And you may have seen her on the Oprah Winfrey Show. She's also appeared in articles such as USA Today, US News and World Report. She's been featured on Fox 5, ABC 7, and CBS. Last but not least, she's an accomplished author and recently published Divine Downloads, Transforming Through Trauma. And I'm sure she'll share that with us. So again, I'm so honored, privileged, humbled to have both of you on the show this evening. And thank you so much for agreeing to participate.
Thanks for having me as well. Yeah.
Wonderful. So we have a little friend in the background. That's okay. That's all right.
In the background.
Okay.
My self-care for our babies.
Okay, wonderful, wonderful. Well, at least they're excited to hear you talking this evening. So for our audience, let's really lean into this wealth of knowledge and expertise this evening. As you're listening to the conversation, feel free to type in your comments, and we'll do our best to address them throughout the conversation and perhaps even after if there are any that are lingering. So what I'll do is just really start the conversation off with asking both of our panelists. We'll start with Dr. Greaves. When we think of women's health in the African American community today, what are two priorities that come to mind?
Well, number one is it's essential to seek medical care, because a lot of women of color, by the time they are diagnosed with a disease, that process is well advanced, and especially in the case of breast cancer. 40% of Black women are more likely to die from breast cancer compared to their white counterparts. And it's because most times, the disease is advanced stage. So number one, getting regular checkups. And then number two is an advocacy for your own health. If you don't know what questions to ask, bring a friend, bring a person who may be well-versed in healthcare or medical professional in your family, or somebody that may guide you. But I would say checkups and advocacy for your health. Okay.
Excellent. And we'll delve more into those really defining statistics that you share with us as we continue the conversation. And Maimah, what can you share with us when you think of women's health in the African American community? What are two priorities that come to your mind?
I think women who are Black and brown on any continent need to be, health is wealth, right? And without our health, we have nothing. And I am a prime example of that. I think it's an important thing to talk about with your children at a young age. My mom taught me breast exams at 13 years old when they were just forming. And I remember being so embarrassed. She's like, take off your shirt and, your breasts are growing. And I was just totally humiliated. But I recall that exact moment in my life and how embarrassed I was. But I made it a practice per her instructions, do your exams every single month. And fast forward 18 years later, taking a shower during my breast exam, discovered a lump at 31 years old. If I hadn't been doing that, I would be dead today. So it's important to have families make health a priority. People leave their kids and money and things, it's like, or whatever, like health is the most important legacy, I think, amongst families. And also being your own best advocate. So when I found my lump, they told me I couldn't have cancer. I was too young to come back in my late 40s or early 50s, because at the time, all the guidelines until recently were saying that women should get screened in their late 40s or early 50s. So that was all the major guidelines, ACS, NCCN, all the other USPSTF. And so I wasn't supposed to be, I didn't fit the profile of someone who would have cancer. So my mom's teaching me at a young age, making a family conversation, me taking it on as a self-advocacy. And then when I found the lump, going to my doctor, who's my OBGYN, and saying, I have a problem. And she said, what do you want us to do? And helping me to advocate for screening, which I got, and it came back clean, because at the time, people weren't discussing dense breasts, which we know women who are younger and who are Black and brown tend to have more dense breasts, which I still have at 50 now. But all those things were things that I had to know my body first, have a mom who advocated for me, have a doctor who pushed for me as well. And even when I got the mammogram results back, the results came back clean. It said you don't have cancer because it couldn't see the tumor in my dense breast, right? So I had to follow my gut and say, you know what, your machine can't see what I can feel. I'm going to keep asking until I have the right answer, and which I did, and took almost a year before I got diagnosed with breast cancer, stage 3 breast cancer. It ended up being stage 2 when at the end of the day. But if I hadn't known what to do, I wouldn't be here today. And so it's become my life ministry to help women understand the importance of Talk to your daughters, your sisters, your friends, pass that gift on. Be your best advocate, follow your gut, follow your heart, and ask until you feel comfortable about what you've heard. And don't stop asking until, and also your doctor should be one of your best friends. So Dr. Greaves, thanks for all you do, because my OBGYN was my ally in keeping me here with my mom. So one helped me in the family, in the household, and one helped me in the healthcare system. And so she pushed for that mammography for me. And so, we have to have that team, right? That's really committed to healthcare, not just having a good time, enjoying life. That's important too. But you want to have a healthy life and a life period to be able to be enjoyed.
Yeah. And to piggyback after what Maimah just said, is that you're not only advocacy, but also a partnership in your health, working with your provider. So many times people come in with a confrontational approach, and you want it to be a partnership. And so that way your doctor works with you and keeps pushing for you, when everybody else says, like, she shouldn't have this statistically, right?
Yeah, my doctor she really, because she could have said, you know what, they're right. The statistics say that you're too young. The guidelines say you're too young. Don't worry about it. You're fine. You're healthy. No cancer in your family. But if she'd done that, I would have been like, well, my mom. Well, what do I do with it? Everything else says shouldn't be thinking about cancer, but I feel like my body's not feeling right. I have this lump here, but she advocated for me. So it does take a team, right? And so, and I'll share more about TigerLily, but it's so important to also know what to ask your doctor, and also bi-directionally educate them on your family, your health history, what you're feeling like, what you're going through, and then have them ask you as well. So it's a teamwork effort, not just a one-sided relationship. And it should be a relationship, not just a transaction, not just I'm here once a year, but you know them, they know you, and vice versa. And that's that connection there.
Yes, exactly. No, you both, and thank you for sharing that personal but powerful testimony. And what I hear resonate from both of you is that the need to empower our young people, and also to advocate for ourselves. And how did you turn? We'll go back to you, Ms. Karmo. How did you turn that trial that you went through into TigerLily? Some people would have, just gone on, this has overwhelmed my life. I really need to move past this, but you decided to turn that around. So share that with us.
Well, how much time do I have?
Also,
I will say that I've always been very introspective person. I've known Dr. Greaves for a long time. Always been very shy, kind of always thinking about life since I was a child, dreaming about, growing up in Liberia. There were so many things that we saw that were, just it was beautiful, but also there were things that were very like heartbreaking, right? And I always wondered, how do I make the world a better place? How do I, what can I do as a child to not have these things be around when I get older and have my own children? How can I serve people who are living here, who are going through things? But as a child, you're kind of helpless to do anything, right? So I always had that heart to give, and be a servant leader in some way, or a servant giver, not a leader. I was never going to be a leader. That wasn't my plan. My plan is to be in the background, which Kondeh knows very well. I was always in the background, hiding something with the book. But when I got breast cancer, as I shared, all these things happened. My mom had to teach me breast exams. I had to do them. I had to find the lump in time. I had to go to my doctor, who I had a great relationship with. She had to advocate for me. The results came back when I got the mammogram negative. I had to believe in myself enough to push for aspiration, which wasn't aspirating, then push for a biopsy. So all these things happened systemically, whether they were in my family, in the healthcare system, with the machines that were not innovated enough yet, where it was like God was telling me, like, I just sat there. I thought, I could die, right? Because I ended up having triple negative breast cancer, which, as you both may know, is the most aggressive kind you can have in any cancer, breast cancer. At the time, there's no treatment targeting TNBC. It didn't exist until 2019. So imagine getting a diagnosis after you've done all the right things, and you're told, well, really sorry, we have nothing for you that's going to target your Black body. We'll give you all that we have and just hope for the best. But it tends to recur in about 5 years, and you probably will be, stage 4 and die. So I'm sitting there in my prime of my life after done all the right things. And I was like, I was shocked. I was stunned. I was scared. I was angry. I was overwhelmed. And I remember going through the motions of thinking I'll do whatever it takes to take care of my daughter, to be here for my daughter, who was 3 then. I don't want to die, but there's nobody who was my age my stage, my subtype, my color. So imagine how lonely and scared I felt. You know,
Yeah.
in Liberia, when there was a war, we would run away and we'd hide, but the war was in my body. I couldn't go anywhere, right?
Right.
And I think when you're faced with a challenge, you have one or two choices. You can either cower and shrink back from the challenge or be a catalyst to make things better for other people. Um, there's a quote I love by Wayne Dyer. He's an author who's now passed. And he says, used to say, when you squeeze an orange, what comes out? And I was like, well, duh, orange juice. But when you squeeze, what comes out is who you are.
Mm.
And when I was squeezed, what came out was like, what I always wanted to help people. So if I was not going to live more than 5 years, my goal was that before anything happened to me, I would create a way that other women would find out, would be empowered about their breasts. I'm sorry, would have moms talking with their daughters about their breast health. They
Right.
would have better positions to advocate for them, like mine. They would have better testing to ensure that they could get the right screening for their bodies. They would have people who would not put them in a box. We would change the insurance regulations and guidelines, and I would wanted to create campaigns. And I had all these big dreams. Like when you're looking at your life flashing before your eyes while you're alive, literally, you have time to think. I was sitting in my chemotherapy chair. I'd be in there for like 5, 6 hours sometimes, and I would just think, what could I do to make things different? And I remember I had my second chemotherapy treatment, and my hair was falling out, and I was losing a lot of weight. I was very, very sick. And I was in the bathroom one day, like on my knees in the shower, like in a fetal position, just crying. I'm like, God, please help me. I just feel awful. I look like, I have no hair, no eyebrows, no eyelashes. Like I'm a shell of myself. Like, why is this happening to me? And how can I mean, I felt like I was dying because chemo is rough, but it also it can help you, right? So it makes you feel bad, but it helps to kill cancer cells. But I felt horrible. And I thought, what can I do with this? Like, show me what to do with this to make somebody else have a better life and better outcome. Make my life a living legacy for other people. And I went to bed that night and I said, God, if you exist, you would show me who you are. But even with that, show me what to do with this situation. What do I do with this? And in the morning, I just got up and I felt like something had happened while I was sleeping. And I felt like God had come to me and said, you asked me to come, you asked me, you challenged me, and you have a calling. You have to serve other people. Just tell your story. And I thought, well, who wants to hear my story? It doesn't matter. And I remember one of my aunts had a magazine and she's like, tell your story in the magazine. And then my first speaking engagement was at a church. I went to a church and I was like, I don't want to be speaking anywhere. I'm terribly shy. But I spoke and people were like coming to me and saying, my sister had breast cancer. My mother has a lump. It was like people were coming, and then that began to spread. And I thought, God, what do? I have no money. I have no charity. I have no nothing. And he's like, TigerLily, make it about transformation and hope and growth. And
Amen.
it began with just sharing my testimony at churches, then on television, then at hospitals. And anybody who would ask me what I was going through, I would share. And then God gave me a vision. He said, sometimes the things that you want to achieve in this life, you have to dream about the impossible and you have to create the impossible. That's what innovation is about, right? But
Yeah.
again, I had no money, but God's like, well, you have your heart. You can love people for a living like you want to do. And so I began to find women who were like me as I spoke. And I thought, how can I serve them? Is by giving them education, giving them empowerment, giving them the idea that they can do better for themselves and their community so that as they learn about their own cancers, like what they're going through, how to ask the right questions about biomarker testing, clinical trials, about how to navigate the mental health aspects of cancer, how to navigate survivorship and the losing a breast, one or both. And like me becoming infertile during treatment, people lose their spouses, they divorce them during treatment. Like, so many things happen. Your children have to be fed and clothed, and your house, the bills keep coming, like all these things. And I'm like, really, God? I just asked you for one thing. I don't know how to do all this stuff. But I really feel like when God, when you ask him to serve and he says, okay, let's do this, that idea that he put in my heart it began when I was in treatment, in the bathroom when I was crying, then the next morning when I got up and he answered my prayer. But it was really to empower women one at a time to light the candle and give them hope. And when they have that hope, they now have the responsibility to pay that forward, to educate other people, to pass that on. And over time, that one program called the Angel Advocacy Program has morphed into over 15 programs, from one whole box program, financial assistance, and we now do policy, science and research, and all kinds of things, and clinical trial work. And we now are global. And so the beauty is that the power is now in that patient's hand, right? That she knows better how to act. We give them tools on what to ask their doctors, how to embrace their journey, and how to look at cancer not as something that's gonna just that could. I mean, it's harmful, but no one's getting out of here alive, right? At some point. So how to use the time that you have in a way that can be transformational and beautiful. And so even though it's about breast cancer and women's health, it's really about transformation and hope and empowerment for women as they navigate their breast cancer and their life care and their healthcare journey.
Thank you. Wow. You
And
have
then
just
yes, I
preached
didn't die. I'm still here. I'm still here 18 years later. So God has
Praise
the victory.
God still has work for you to do. And even now, just you sharing the story over and over, you cannot imagine how you're blessing me, how you're blessing so many others who are listening this evening, and just providing affirmation about service and just holding on. So thank you. Thank you.
And you
We'll come
found
back.
your voice. You found
Yes,
your voice. You know?
You know,
yes.
and
We'll come back, to the angel advocacy for a minute. And, about finding your voice, I just wanted to, you mentioned about screening. So I wanted Dr. Greaves to share with us the current screening recommendations. I know we have a slide on that, just to kind of share just the current recommended screenings for women of all ages, breast cancer screening.
Yeah. So this is just a slide just telling you that 1 in 8 women in their lifetime will develop breast cancer. And that's quite jarring, 1 in 8. And so that's why it's so key that knowledge is power, going for your screening and doing exams, self-breast exams, and following up for regular checkups. So 98% of the time, if it's found early, the survival rate is higher, of course, and then 27% survival rate when it's advanced stage. So to answer your question, maybe we'll move forward about the breast cancer screening. I want to talk about the guidelines for mammograms. So as Ms. Maimah mentioned before, we're still advocating for screening beginning at age 40. That's based on the American College of OBGYN for mammograms. This is for people with what we call average risk, okay? And it's every 1 to 2 years until age 75. And I tell patients it has to be an informed and shared decision-making process. So if you find a lump, if there's a family history of breast cancer earlier than age 40, you need to be screened earlier than this. This is just the current recommendation, okay? So patients medicine is not a cookie cutter kind of situation. It has to be tailored to the patient, but this is just the standard guideline. And then in the United States, Preventative Services Task Force came up this year in April on the 30th. Before they were advocating for screening at 50, even later, age 50. Right. Now they've come on board to say start screening at age 40 and every 2 years. So again, it has to be an informed and shared decision-making process between you, the patient, and your obstetrician and gynecologist, because this may be the standard recommendation, but you are an individual. Every woman is different. But for now, this is the standard. And then after 75, it's not felt that the risk of breast cancer is as high. So that's why the recommendation is to stop at 75. But again, it has to be tailored to the individual. Then I cannot stress the importance of self-breast exam. And I was pretty impressed by Maimah's mother starting off with her as early as 13, For us as obstetrician and gynecologists, we don't start seeing young women until 18 for the most part. I start telling my mothers, bring them in as early as 13 and 15 just for a conversation. We're not doing a pelvic exam or anything traumatic. We're just having a conversation, getting them to know their body. Knowledge is power. So the fact, kudos to your mom, Maimah, that she had you starting your breast exams that early, good. This, again, the standard recommendation most times for us from the medical world is age 20 to start doing self-breast exams. But start early. So normally I tell patients, how do you do it? So I like this simple diagram that we have ahead of us, where you want to first stand in front of a mirror. You want to look at your breast. Looking for any changes in the skin of the breast, because a lot of times breast cancers do present with skin manifestations. Okay, so you want to look at the skin. Is there a puckering in of the skin, something we call peau d'orange, which is like orange peeling in French, the translation to English? Is there, do you actually see a lump protruding from the breast? Okay, is there a rash that may be kind of scaly on the breast, which sometimes can be also a skin manifestation of breast cancer? Then you want to put your arms above your head and look again closely, looking for any changes to the breast. And then you can lie down and with your opposite hand, examine the opposite breast. And you're using these 3 fingertips. And I normally tell patients, for me, the easiest way is to go around in a circle. I make big circles starting from the outside of the breast, working my way to the nipples. And what are you feeling for? You're feeling for something hard and firm. And I tell patients it's almost like you're going on a scavenger hunt for a marble. And even if you don't find something firm as a marble, and you do find something squishy or like, I'm not sure what it is, still come to see us so we can examine it and further investigate. Don't blow it off, okay? And then you also want to feel up into the armpits of your breast, what we call the axilla, because your breast tissue extends there. And then end by squeezing your nipples. If there's any discharge from your nipples, like blood, certainly not normal. Pus may indicate infection. And then also sometimes it may be a milky discharge, which could be a tumor somewhere else in the brain, okay? So any lumps in the breast or drainage from the nipples, go and see your provider, okay? And so even if you're younger than 40, if there is a mass, we need to do further investigation, or if there's a drainage, okay, from the nipple. You can also do this in the shower. And for some people, it's easier too. So you're standing up in the shower and again, in concentric circles, working your way to the towards the nipples, feeling for any lumps, feel up in your armpits and squeeze the nipples. And it may be a little bit easier when the skin is wet in order to do that. So either lying back or standing up. And when's the best time to do it for women who are still having periods? The best time to do it is after your period. Not prior or during your period, because your breasts are more tender and sensitive and lumpy, so it may not be an accurate exam. And then if you're menopausal, pick a time in the month. It can be the beginning of the month, the middle of the month, something that jars your memory, and put it on the calendar so you're intentional about your health and going on and doing these exams monthly. And again, if you find something, come and see your OB/GYN and get evaluated further.
Well, you've heard it now. You've heard it from both Dr. Greaves. You heard it from Maimah, who's a survivor. You have to be intentional. Do not be afraid to do these breast exams. Don't let fear stop you from doing what is necessary. Early diagnosis is key. We don't want you to find anything, but you can see how just that determination by Maimah, finding out early, and then continuing to advocate for herself. You know, as a pediatrician, I saw quite a few young ladies who also came in with lumps, bumps on their breasts. And we always have that conversation, the parent, the child, and myself. We don't want to just brush this off, right? You're worried, I'm worried. Even for young teenage patients, they can have an ultrasound. They may not be able to have a mammogram, but you can have an ultrasound to see what's there. So we encourage you, if you have a young lady in your home and who's found a lump, just like Maimah said, don't brush it off and say they're too young. And Dr. Greaves, just thank you for sharing those guidelines. We know it's something that's constantly, in flux, but currently that's where we are. So once you find that abnormality, so for both of you, let's start with Maimah, speaking directly to a woman or even a man, because men can show up with breast cancer
too.
Yeah. If they've discovered that abnormality or been told by their provider something's not right, what would you caution them to do first?
Well, I wanted to go back to the previous question. I have to address something. So I think, all the women, we tell women and girls don't start getting or looking for doing breast exams till they're, in their, I think we said 18 or so or 16. I think creating a lifestyle of healthy body awareness is key, right? So you don't even want to talk about breast cancer maybe at 13. My mom never brought up breast cancer. She just said to me, know your body because it changes. And so that if it changes, you're the boss of your body and you know what to look for. If something's weird, let me know. So it wasn't about scaring the young woman, scaring them. It's about empowering them to be strong young women, right? Like you do with getting them educated and being advocates, being able to speak up and be confident. That confidence should extend towards your body confidence, be able to honor your temple. So how you talk with your daughters about their breast health is a way to empower them to have a healthy lifestyle. Because as I spoke about too, so it's the first thing, they could start off at the earliest the breast. Once they begin getting the breast, start talking about it and make it a conversation that's about empowerment, not about cancer per se. And then at an age appropriate time, you could bring up maybe, because this happened, maybe a grandmother had breast cancer or there's a risk factor, but you want to make it an empowering conversation. Second of all, it's important to realize that the guidelines are just that. They're guidelines, right? And they're for the average risk people. But we know that Black women get breast cancer and die at twice as rate as women who are non-Black, right? So we don't fit into those guidelines. And so if you do have a symptom, the guidelines are meant to be an overarching guide, but they're not prescriptive for your body, right? So if you feel something in your body's wrong, see a doctor and be your best advocate and figure out what it is to get it out of your body or get it tested, at least make sure it's nothing. If it is something, you can act on it. So I think it's really important that people realize that these guidance are just that. Again, be your best advocate. And also the guidance has changed. Do you know why? Because advocates made that happen. People spoke up about the guidance being 50 years old. People like me who've been fighting for change since I was 32, like my diagnosis. And so you can use your voice to change things that don't work for us as Black people. You don't have to accept them as status quo. And so those are my 1, 2, 3 cents. Yeah. So what were you asking me again?
Oh, no, that's okay. No, Dr. Greaves, I wanted you to, just.
You're asking me, I think you said when people, you're asking Dr. Greaves a question about what to do.
Yes, what to do when someone notices a lump. So we'll start with Dr. Greaves and then come back to you, Maimah. What to do if you notice a lump. But thank you for sharing, that overarching. Both you and Dr. Greaves share that the guidelines are just that. So.
Exactly. And again, I can't say it enough that as a practicing physician, I always see the individual as an individual. And so despite the guidelines, whatever you present to me or I find on exam, we're going to go down that rabbit hole till we find what's going on with you. Okay. So paramount. And that's why knowledge is power. Knowing about your breast, what normal looks like and what abnormal looks like. So it's not always cancer. It could be something benign. They're like benign tumors of the breast, something called fibroadenoma. That's quite common. There's so many things. But definitely if a woman presents with a lump in the breast, we want to find out if there's a family history of breast cancer, especially if they're younger than 40. And then definitely if it's a solid mass versus a cystic mass, if you're less than 40, I will probably want you to go and get an ultrasound of your breast. And then if there is a solid mass, then we probably will recommend a diagnostic mammogram and a biopsy of that mass to see what it is. Is this something that's cancerous or not? Okay. And then now just recently, I think in the last week or so, I was watching TV and now they're saying they're putting disclaimers on the mammogram, Maimah, saying they have to now tell patients or indicate that their breasts have dense tissue. Mm-hmm. And like she mentioned, African Americans or women of color tend to have dense breasts, and especially the larger your breasts are. Okay. Right. So it's very, very important that, with the dense breast tissue is more difficult to find masses. And like in the case of Maimah had mentioned for herself. So follow your gut. If you feel something and something's going on, don't stop. Keep talking to your provider. If it means going for a second or third opinion, do so. Okay. So I tell patients all the time, I'm not God. Listen. So if you don't agree with what I'm saying, or I'm not satisfying what you're looking for, or we're not reaching to a common ground, please seek a second or third opinion, because this is your life. And again, you have to be your best advocate. Okay. So I can't stress enough the importance of exams, following through with imaging, biopsies if indicated, diagnostic mammograms, which are more specialized mammograms than just your routine screening mammograms.
I really am glad you brought up the issue around dense breasts being that's now it's required to be told to patients, because I want to stress again to people who are watching this, patients made that happen. People like myself and others who were touched by breast cancer or who were missed by a machine, like they went on Capitol Hill, they went to their state capitol, they advocated, they wrote letters, they talked about the issue. Like the power that people have is so amazing and so huge. And so if something happens to you that you think is not normal, like for me finding my tumor at 31 years old, if I hadn't talked about it, I would never have begun TigerLily. I would never have reached women all over the world with these programs and inspired them to do other things. And the ripple would never have happened, right? So if something's going on with you and you advocate for change in your community, that could help save millions of people's lives. And so don't think about yourself, of course, that's so important. Put yourself first, take care of your health, and then think about the fact that people have used their voices to change policy that'll help other people have better screening outcomes, earlier outcomes, and diagnosis to be able to get treatment. So that you mentioned earlier that I found my voice, other people can have that voice too. And just knowing that you can use that voice to save lives and extend life is so powerful.
Amen. Amen. And
Absolutely.
also, yes, yes. And the fact that you have the Angel Advocacy Network, you started talking about that. We were so blessed to have you all join us. We had our inaugural health fair of the AME Zion Church in July of this year in Greensboro. We had over 27 national and local organizations represented, over 300 attendees, and we had a breakout session. So the Angel Advocates actually had a breakout session with about 15 to 20 women and trained them to be angel advocates to go out into the AME Zion community and share that knowledge. So thank you for—
I have chill bumps right now.
Yeah, it's exponential. We want to continue that work. So everyone listening, if you'd like us to have the angel advocates come out to your area virtually, let us know in person. We can
We're not going to
arrange
ask them. We're going to tell them.
Yes.
to be a servant leader. And now that you know better, you have to do better and help your sisters. So you have to become an angel advocate. You can contact us at TigerLily Foundation. We have Instagram, Facebook. We have a beautiful website. Become an angel advocate. And all you do is you just get trained online. It's like a quick, like a week and a half period or whatever it is. I'm sorry, 6 weeks period. And then you're now able to be an angel and go out there and help people to have better education, better resources. And so we're asking you as part of your ministry to do better for others. So we're asking you and we're volunteering you to go and do better for your sisters.
So
awesome.
Yeah. And we'll have all those links that Maimah is mentioning. You'll see them scrolling across the bottom of your screen in a moment. So we wanted to switch gears just a little bit, but we're going to come back to breast health because, October is when we really acknowledge, make sure that we're talking about breast health. But we wanted to talk about some other areas of women's health. So Dr. Greaves, what are 2 other issues that we know really affect African-American women that you wanted to touch upon today?
I wanted to touch 2 areas, specifically in the area of cervical cancer screening.
Sure.
And on uterine fibroids. And this is going to be very brief, just an overview. Again, this is information because I feel knowledge is power, and then you can go back to your health providers, look into your own personal health and advocate for yourself and family members. And one thing I want to just put out there, a lot of times in communities of color, and especially with our families, talking about our health seems to be taboo. And it's very important when you hear your providers asking you, any breast cancer in your family, any cervical cancer or colon cancer. This is not a time to be coy or say, oh, I don't know, or whatever. Or sometimes go back and ask grandma or your mother, is there any family history? Because some types of cancers are familial, meaning they're hereditary. It can be passed through families. So it's very important to have a conversation with one's daughters, aunties, uncles, because men get breast cancer too, Colon cancer is, very high in the African-American community and people of color. So no matter what age or gender. So very important to have those conversations, what's running in the family. Not only your bread and butter of hypertension and diabetes, but different cancers, okay? And with that said, if there is a strong family history of breast cancer, cervical cancer, other types of cancer, then that will probably prompt your screening to be done earlier for certain things, or especially if you do find something abnormal. So just segue into cervical cancer. Cervical cancer is one of the most preventable cancers out there, okay? And why do I say that? Cervical cancer screening usually is started around age 21, okay? And the recommendation is to do cervical cancer screening from age 21 to 29 every 3 years by doing pap smears. If we can pull that up, okay? So when you go to see your provider, if you've not had a pap smear at age 21, that's when we start screening, then we recommend that. And it's every 3 years if your pap smear is normal. We're also advocating for young women and boys to start getting HPV vaccinations, human papilloma vaccinations. And that is the virus that causes cervical cancer in women. But there are several hundreds of strains of human papilloma virus. They cause anything from genital warts to cervical cancer or throat cancer. So depending on the type, but specifically there are higher risk ones that can cause cervical cancer. So just like how you would get the flu shot every year, the HPV vaccination is being recommended from ages 9 to 45. And so if you're less than 15, you get a 2-shot series. If you're older than 15, when you get your first dose, then it's a 3-shot series. And very, very important to prevent cervical cancer. So that's why it's one of the most preventable cancers out there. So if you can start getting your kids vaccinated, or yourself, if you're within that age range, it's so important to do so.
And you're speaking that language, Dr. Greaves. As a pediatrician, we strongly advocate and recommend for HPV vaccination for our young women and men. And it's not about a sex thing. A lot of parents still believe that, it may make their child more promiscuous.
Right.
And studies done on that, it shows that it doesn't. This is a cancer preventing vaccine. And you just shared that. And so we encourage you, if you have questions, ask us about the HPV vaccine, but it's safe. I've given it to my daughters, my nieces.
Yeah. And I've given it to my son. So, so important.
In the event that a child is young and somehow they're active, or something happens that's not expected, or, that they're protected, right? Because I've met women who have had, assault, and they've been, and they didn't tell their parents because they were afraid they might think that they were being, getting active early, and it went on to progress into a cervical cancer issue. And so it's important to not stigmatize this kind of thing, right? Because we have this perception of if a girl's getting the vaccine, then she was going to be, or it'll make her be more whatever. But these things do happen. We don't know why they happen. But I think it's important to make people feel empowered around this with their daughters. It's an empowerment tool that they're empowered to keep their bodies safe. And you may have a partner as well who you think is a long-term partner that you're safe with, and then they're not being safe because they're doing other things. And so there's different scenarios that are not about, someone being, overtly active early at a young age. It could be an adult female that has a long-term spouse, something happens. So it's just really important to, again, make it about empowerment and being in control of your health, and not disempowerment.
Awesome. Absolutely. You're the captain of that vessel. So definitely take control. and so and again, in addition to the HPV vaccination, also I tell patients, because most HPV infections that causes cervical cancer is transmitted sexually, to use condoms. I can't stress that enough. Safe sex to help the prevention. And so I talked briefly about the screening age starting at age 21. We don't do it less than 21 because most times when young people do get exposed to HPV, they can clear the virus early. So that 21 is the age that we start screening for cervical cancer. So 21 to 29 is a pap smear every 3 years. And then when you turn 30 to 65, there's a combination of tests that you can do. You can either do a pap smear every 3 years if that's all that's available in your area, or you can do what we call co-testing, which is a combination of a pap smear and HPV testing. So you're doing both. Or they may do what we call a reflex, meaning if there's an abnormal pap, then they check for the high-risk viruses for the HPV. Or they would just do only a HPV testing where they go straight to the source, trying to see if you have the high-risk viruses that cause cervical cancer. And so with the combination pap and HPV and the HPV testing only, if those tests come back normal, they're good for 5 years. That's the recommendation, 5 years. But again, if there's any exposure or anything that you need to see your doctor for, again, these are guidelines that we mentioned, please see your doctor earlier. And then if it's just a routine PAP done between the ages 30 to 65, it can be every 3 years. So it all depends on what's provided at your center or your doctor's office, okay? But very, very important, because if every type of cancer, if found early, can be stopped from getting to a place where it's advanced stage and then one loses their life. So important to do screening.
Okay. Fibroids, as African-American women, this is something that everyone I talk to
Yes.
either has it or knows someone. So what can you share with us about fibroids?
Fibroids, yes, just like you rightly said, Dr. Beslow, it's one of the most common tumors in women of reproductive ages, but more so in women of color. They're benign, meaning they're not cancerous. They normally present with a myriad of symptoms where a woman sometimes will present with their abdomen looking almost like they're pregnant. In fact, as an OBGYN, when we evaluate you for fibroids and we're checking the size of the uterus, we compare that to a pregnancy. So we will say, oh, this woman's uterus is 10 weeks size, which is equivalent to a little bit over 2 months, or this uterus is 20 weeks size, which is equivalent to 5 months of a pregnancy, just to give you some idea of how big the fibroids can get, where the woman's tummy can protrude and they look like they're pregnant, but they're not. The most common presenting symptom for most people with fibroids will be heavy periods, very heavy bleeding. Some people will also present with abdominal pain or this pelvic pressure sensation, because the fibroids, as you can see in this pictorial, if they get very large, they can press on the bladder and the lower abdomen. So you have these pressure sensation. Sometimes women can have pain with sexual intercourse, but the most bothersome symptom most women present with is this heavy bleeding, where they feel like, some women describe it that they've turned on a faucet during their period and they're bleeding and going through ultra tampons and pads, and it's just sometimes very embarrassing. They're at work and they're, it's messing up their clothes and they have to run to the restroom. So this diagram just shows fibroids in the different locations and the different types. So looking at so this is a picture of a diagram of the uterus, the tubes, and the ovaries. There are 4 major types of fibroids. There's a submucosal one that's in the lining of the uterus. There's one called a pedunculated fibroid, meaning they're hanging off the uterus because, they're just like hanging off a stalk, like a grape will hang off the stalk. And then there are intramural fibroids, meaning they're within the wall of the fibroids, and then a subserosal one, again, under the lining. And all of these fibroids can present with bleeding, pain, and those symptoms that I mentioned before. So the most common way to diagnose the fibroids is by ultrasound and examination. On exam, especially with a patient presenting with heavy periods or pain and with an enlarged uterus, your physician may then say, okay, this is highly suspicious for a fibroid. Let's get an ultrasound done. And that's how we can diagnose to see how many, how big, and where they're located. Treatment options, that seems to be the main thing that women have to come to their physicians informed about their disease process. Do your research, and then ask the right questions. So the two mainstays for treatment for fibroids is either medical management or surgical management. And then it also depends on where you are in your reproductive journey. If you're someone who's never had children or plans to have children, then your first option may not be to go towards that hysterectomy or myomectomy or the surgical approach, because you want to preserve fertility. But it also is very paramount to have that discussion with your provider as to what your wishes are. And then if you're someone that's reached at that stage of your reproductive journey where you're like, look, this is enough of these symptoms and I'm done, and I want to have a definitive procedure such as a hysterectomy or myomectomy, those are options. So let's go back to talking about medications, if I may. So if you're having heavy bleeding, it depends on your symptoms. Most times, most people present with heavy bleeding. Normally, the mainstay for treatment would be birth control pills, where we're manipulating the hormones to control your bleeding, or a progesterone-based IUD. The most common one out there is something called Mirena. And what that IUD is doing is slowly releasing that progesterone hormone to help to control and decrease your bleeding. Some people, all they have is just severe pain. And so sometimes just a regular ibuprofen Aleve, if the fibroid is small enough and that's your main symptom, may do the trick. And in addition, a lot of people are not aware of this. If you're taking this ibuprofen and Aleve on a regular basis, not every day now, but it can also decrease the flow of bleeding. Okay, so it's a two-pronged approach. And then there are other options out there. There's something called Lupron, which is an injection you can get every 3 months or monthly. And depending on how large the fibroid is, they use that to shrink the fibroid, while you may be wanting eventually to get a myomectomy, getting the fibroid removed surgically. So that's an option to curtail that bleeding. Or there's something called TXA. This is limited though, tranexamic acid. You can't take it for a prolonged period of time. It's just a couple of days just to acutely bring down that amount of bleeding that you're having. So those are some simple first step approaches for fibroids. And again, it has to be a shared and informed decision with your provider based on your reproductive health, where you are, how many fibroids, how big, and whether this is medical management is something that can be handled that way. Or the other approach is surgery. And if we go to the surgical options, if you're somebody who's still wanting to have children or have not had children, you can do something called a myomectomy. Again, that's if you're eligible for this type of surgery where they're individually going and removing the fibroids. But keep in mind, by doing those individual removal of the fibroids, you can, damage the uterus. And in the end, when you do have children, will probably need a C-section for delivery, depending where those fibroids are, how deep inside of the lining of the uterus that fibroid may have extended. Then the final step will be a hysterectomy, where you're removing the entire uterus. That way you're taking away the source of the bleeding entirely. And that's if you're at the end of your reproductive journey, or you may not be at the end of the reproductive journey, and this may be a life-saving event. And then there's some, newer surgical approaches. I put this up there because it's kind of new, and it's called the magnetic resonance guided focus ultrasound surgery, where you're using MRI to first find the fibroid, and then the ultrasound waves to go in and individually destroy the fibroids. And that's typically done by a specialist called the interventional radiologist. So you're actually seeing a radiologist and not the OB/GYN for this procedure. But of course, you'll see your OB/GYN first. So in a nutshell, these are some common treatment options. But again, you have to see your provider, see what works for you, and then have that discussion as to how to be treated.
Just wanted to say thank you. Thank you for sharing this. Knowledge is key. Knowledge is power. We're so thankful for just sharing all these various treatment options, because a lot of women suffer with fibroids. And we're just so thankful, that you've been able to share this, the guidelines for cervical cancer screening, guidelines for breast cancer screening, and also recommendations. So we only have a couple of minutes. So I'm going to ask each of you in just a minute to kind of summarize for our audience. What is the takeaway? What would you say to a sister, a mom, a daughter, a niece? What questions should you be asking your healthcare provider? What information should you be leaving that visit with? So how can we empower them? So we'll start with you, Maimah.
Oh, wow. Okay. So for me, I feel like what there are several things that kept me on this earth, right? Having a mom who knew enough to educate me early. So if you're watching this, talk with your daughters about their bodies and about being empowered when it comes to their breast and cervical health. Number two, you have to take what they've taught, what your mom teaches you, or your sister, whoever, your auntie, whoever, and be your own best advocate. Know what the guidance is, but know your body enough to know what's best for your body and when to seek help and when to say, I'm not going to stop till I have the right answer. The third thing is have a really healthy physician relationship. Your doctor could be one of your biggest allies in your healthcare journey, in your life journey. Somebody you love, that you like, you love, you trust, that you get along with as well. And also, once you know better, you have to do better. So once you know enough about family health history and how to advocate for yourself and how to speak up with your provider and have that relationship, you got to pay it forward. I think that's one of the most rewarding things you can do in this world. God didn't give us gifts for us to hold them to our chest. He gave us gifts to open our hands and share them, right? And so once you know better, there are people in your community who are literally dying to get the right information or the right access. And so just having that, talking to our friend about the importance of getting her mammograms once a year, or saying, I'll go with you if you're scared or uncomfortable, or sharing your story or something, whatever you learn could save someone's life or extend their life. And so again, moms and daughters, have the conversation, be your own best advocate, pay it forward, and then you want to just keep sharing the information because knowledge is power and advocacy is power. And I feel like last but not least, how can you create a living legacy, right? I never imagined that my work and my speaking, my begging God to make a difference would have led me to have an 18-year career so far in this space of serving other people. And so the more you give to others, it's a beautiful thing of what could happen for you, right? And what could happen in the world. So be open to what's possible and think about maybe creating the impossible and seeing what happens. You could save lives.
Amen. Thank you. Thank you. And Dr. Greaves, again, I'm coming to you. What questions should I be asking you? What information should I leave your office with?
Well, coming to see your OB/GYN, it all depends on one's age, right? If you're 21, between the ages of 21 and 30, if you're sexually active, you need to have a pap smear if you've never had one for cervical cancer screening. And then I recommend for every woman to get an STD screen, because if you're sexually active, you want to know if you're at risk for certain diseases or do have a disease that could be transmittable to your partner. And that way you need to have honest conversations with that person. And safe sex is what I recommend all the time. If you're young or between the ages of 9 to 45, get those HPV vaccinations, please. For breast cancer awareness, it is something you have to take control of your body and regularly do your self-breast exams. And if you find something, come and see your provider and go down that rabbit hole. If that doctor is not willing to do so, go seek a second or third opinion. Advocate for yourself, or even go with a family member who may need that help as well because they don't know what questions to ask or are scared. I've had people tell me, I don't want to do a mammogram, Dr. Greaves. That thing will squeeze my breast. I think it's best to get your breast squeezed than to die, right? Mm-hmm. So for that little time of inconvenience, go ahead and get your mammogram done. And if there's dense breast tissue or large breasts, and there's any suspicion or a family history, again, Find out about your family history. We now offer genetic testing. If you're a carrier for the breast cancer gene, the BRCA1 or BRCA2, you could pass it on to your family members, especially the girls, if you're a mother. So please, if they don't offer it at your place of medical care, you can find out in the community where you can go and see a geneticist, and they go through your family history and see what other types of cancer, not just only breast cancer. And then again, knowledge is power. You have to educate yourself if you are diagnosed with a disease about that disease process and how it can end up. Two other things I forgot to mention about treatment options for people with uterine fibroids. There's something called a uterine embolization, where they see a radiologist and they plug up the blood supply to the uterus, and that's a non-invasive procedure that you can do without surgery to kind of kill off the fibroid, so to speak, or something called an ablation to burn the lining of the uterus to stop your bleeding. Those could impact fertility. Again, it all goes down to what are you planning to do in terms of your family in the future? Are you planning to have kids or not? And then again, regular checkups. See that doctor. If you have insurance, I tell patients, you have the option of coming every 1 to 3 years, but if you have insurance, go every year. Go see that doctor, okay? There's nothing wrong. And even if you think you're going to be a pest, I'd rather you be a pest than not, and you come in with advanced stage cancer. So important. If you don't have insurance, there are different outlets in the community. There are free healthcare centers or places where they may have free mammogram or imaging. Maybe Maimah may have more insight there in your community. So please don't let that be a deterrent to seeking care.
Excellent.
And so just talk to your family, encourage them to also go in for checkups, maybe have a buddy and say, okay, this is the time we need to do our mammogram. But so important, please, knowledge is power. Seek the care that you need, be the advocate that you need to be for yourself or for a family member.
Amen. Amen. Thank you to both of you. And you both, have just straight talk. And that's what we need to hear. We don't need to shy away because this is a church-sponsored interview, right? We need to be very transparent and open and honest with ourselves, with our families, and just have those straight conversations and honest conversations. So thank you for your knowledge today. And thank you to our panelists, again, for just agreeing to come on. Thank you to our audience. You've hung in there with us this evening. We appreciate you. Thank you for the questions that you're sharing. And those that we were not able to answer, we'll still try to get you some resources. We want you to stay tuned for some upcoming interviews over the next season. We're going to be talking about protecting ourselves from respiratory illnesses like COVID, flu, and RSV. We'll also have some health insurance specialists come on and talk to our older adults about how to choose that Medicare option, and also estate planning, living wills, etc. And then by the end of the year, get a jump start on your exercise routine before the new year starts. We'll have an exercise specialist come and share with us. But again, we just want to say thank you to both our panelists today, Maimah Karmo, President and CEO of TigerLily, and Dr. Kondeh Greaves, a practicing OBGYN in Ashburn, Virginia, with Kaiser Permanente. And I thank them so much, and to Brother Darren Kent, our Chief of Communications, for hosting us this evening. So thank you, everyone.
Thank you.
Thank you for having us, and thank you, Maimah, for your story. And like I said, you found your voice, and thank you for that.
Oh, thanks for all you do, both of you. I feel very full. This has been a beautiful conversation.